start with this session with a keynote address on Transformative Health CSR Innovating for Comprehensive Community Wellbeing by Dr. Jitendra Sharma, Managing Director and CEO, Andhra Pradesh MedTech Zone AMTZ.
I think this conclave, CSR conclave, I think the best corporate social responsibility is giving knowledge. And the biggest donors are teachers. And therefore very nice, Dr. Sudeep, that you chose this day to do a CSR conclave, because I think there is no bigger CSR than giving knowledge. Every wealth, every product, every service, everything that we bring out is because of the knowledge that our teachers gave us. थोड़ा सा आपको बताना चाहूँगा why we are here, joining forces with Dr. Sudeep and all the members, many friends who are around in this hall. I represent an organization called Andhra Pradesh Medical Technology Zone. We are world's largest medical technology manufacturing cluster. We are very small, 8 kilometers campus, 98 lakh square feet of production space, and we make very few products, which includes right from a mask to an MRI machine. We make India's first MRI, India's first CT scan, India's first solar-powered wheelchair, India's first heart valve, something even as small as India's first hearing aid. And the reason why we, thank you sir, the reason why we do this is that our country is import dependent on medical technology to the extent of 65,000 crore per annum. Very small number, 65,000 crore. शायद हमें इतना भी पता ना होगा outrightly कि इस नंबर में कितने zeros हैं. 65,000 crore. We don't know how many zeros are there in this number. That is the import dependency of our country in medical technology. Right from a low weight wheelchair to a hearing aid that comes into India for 13,000 rupees, to a CT scan or an MRI, we are heavily import dependent country. So what AMTZ has done is that we created a huge infrastructure to produce the same MRI that we used to import for 6 crore, we today export at 2 crore 80 lakhs. The same hearing aid that we import at 13,000 rupees, we produce at 1,900 rupees. And a prosthetic limb that we make, we produce one leg for 4,000 rupees. There are mobile prosthetic limb production buses where people come without the legs in the morning and they walk back in the evening using a prosthetic limb. That is AMTZ. AMTZ is also home to 145 companies. It's a $1 billion cluster, and it's a place which is having the first World Health Organization Center of Excellence for Health Innovation and a World Trade Center. So we are the only cluster in the world that has a WHO center and a World Trade Center. We bring science and business together, and that is why we are here. Now, from a perspective of CSR and our ability to do things together, I can only share that there are 3 forms generally in which CSR is done. One, we do CSR for a product. We donate a wheelchair, we means in general, a hearing aid, a hospital bed, an ECG machine, that's contributing for a product. The second category of CSR by and large, besides like the first category in which we give a product, in the second category, we do contribution towards a service. और आप लोगों ने WhatsApp में देखा होगा, somebody is doing अन्नदान, somebody is saying donate a meal, somebody is saying donate for education, somebody saying donate for a skill. That is how we contribute as a society in the form of service. And the third form, which we also practice very much at AMTZ, is can we donate for an idea? Can we contribute for an idea? Because an idea could become both a product or a service. It could be anything. It could be ultra fast track cervical cancer screening that previous panel, the panelist was mentioning. It could be world's first cornea based detection for anemia, which does not require blood. And somebody was mentioning about anemia. And therefore, before an idea becomes a product or a service, it also needs support. Ashok Bedi ji is sitting here, who manages the entire Bossia. It's an idea. It is just financing an idea. It is neither a product nor a service. It could be both. Vivek Saigal ji is sitting here, who has done tremendous contribution to industry. Mr. Gaur is here. Large number of fascinating people who have not necessarily funded or got funded a product or service, but funded an idea or got an idea to be funded by multiple forces. And therefore, my request to Sudeep ji is, this very conference is an idea. It is neither a product nor a service. But you have created an idea which has pulled together multiple people, from a gynecologist to a practitioner of physiotherapy to an organization that supports sportsmen. You have brought together multiple people from multiple PSUs like us, Indian Oil, NBCC, NTPC. These multiple organizations, all of us deal with either a product or a service. People like us who are producing wheelchairs or MRI, people who are in education ministry who are financing and supporting education, Dr. Nilesh who is providing care, all of us are either in product or service. But I think our true innovation today would be, can we fund ideas? Because if we can finance, contribute, develop, donate, support ideas, these ideas can become either product or a service. It could be a common salt which has iodine. Iodine Man of India is sitting here. Or it could be creating people who are Divyanjans, creating the new service delivery model for Olas and Swiggis using only their services. And there are messengers and groups that are already doing this in various scattered places in the country. आप लोगों को याद होगा, बहुत समय पहले there used to be an advertisement in TV for Lijjat Papad, Mahila Grah Udyog, right? Much before it produced Lijjat Papad, it was just an idea of a group of women. They wanted to do something. Lijjat Papad was just one product. The entity was Mahila Grah Udyog. It was an idea that told women that sitting at home without going out of the house, because to do that at that time you had to fight through various layers in the society, and that fight would consume all their time and years. So escaping the fight, within the home you can run an industry, you can create an industry. That is why it was named Mahila Grah Udyog, not Mahila Udyog, Mahila Grah Udyog. So that there are no fights. You don't have to challenge. Today, thankfully, our society has enough power to challenge those systems. But 30-40 years ago, there was no power. There was no critical mass of proud women thinkers. And therefore, very smartly, they named it Mahila Grah Udyog. हमें किसी से झगड़ा नहीं करना है, हम तो घर से बाहर जा ही नहीं रहे, हमारा उद्योग ही ग्रह में है. And they created an industry which became India's first FMCG brand, Lijjat Papad. And therefore, my request today is that yes, my colleague Mr. Dr. Amit Sharma ji is also here, I don't see, there. They make wonderful, and AMTZ is a campus with 22 centers of Government of India. He operates one of them, where we make buses. We provide limbs for 4,000 rupees. As I mentioned, people walk in the morning without legs, walk out, walking back on a prosthetic leg. From a low-cost hearing aid to a packaged health kit for the entire 9 months of pregnancy, the detection, the ECG, the everything, the blood pressure for eclampsia, everything. Dr. Swadeep Srivastav, they also have a center at AMTZ where we produce, under the brand of India Health Link, a healthcare ATM, an ATM machine which does profiling of more than 200 parameters connected with telemedicine. Cost of service 25 rupees per patient, as low as that. And Honorable Nitin Gadkari ji wanted to put one at Toll Plaza in Nagpur on the national highway. He told us last Monday when he was launching the India's first solar-powered wheelchair, a wheelchair, electronic wheelchair that comes into the country imported for 1 lakh rupees. We produced a solar-powered wheelchair for 30,000 rupees, and he was kind enough to launch it in Nagpur. But that healthcare ATM, which costs 25 rupees, which is lesser than what we pay on FASTag, right? So there are multiple products and services that you will encounter in life, encounter in this very occasion, in this very conclave, meeting wonderful people. But I think today, if we can create a bank, Dr. Swadeep, as one of the suggestions, and the only suggestion I have for this conclave, is that let this conclave not complete today. Let it start today. And let us create a bank where we support ideas. A CSR conclave, which is a rolling conclave, happening every day of our lives in our routine works. We only contribute for ideas and support them until idea becomes a product or a service. And I think if we can start that idea bank, where the bank is also banking the idea and also banking the financing. We are financing the ideas that come into the bank, and the eligibility for it to be financed monetarily is only if it is part of the CSR Idea Bank. I think that will be a very, very good contribution to society on a Teacher's Day, where the work and blessings of hundreds and thousands of teachers can actually create India's largest CSR Idea Bank, where every idea is funded by CSR. Where we don't say people who bring ideas to go and raise capital from venture capitalists, because they will take away your 60% equity. They will cut a check, but then the company is gone. It is gone for profiteering instead of sustainability. And therefore, large number of industry leaders that I see here, many of you who started your career with as part of a profiteering company, but realized that you are meant for something bigger, something grander, nobler, left that, migrated to creating sustainability. And profiteering is different from sustainability. Sustainability requires profit, but the agenda is something different. Agenda is something bigger. All of you have done that. Can we bring together all the sustainability champions here? The financial sustainability, environmental sustainability, functional sustainability, physical sustainability, all the champions here as messengers of the CSR Idea Bank, and as PSUs, as professionals, we commit to support the CSR Idea Bank, where every idea will be supported only through CSR if it is sustainable. So let us start this conclave today and create the CSR Idea Bank, which brings out hundreds and thousands of products as a contribution to the country.